Hi, this is Dr. Susan Gerleo from the Biz Savvy Therapist, and today I want to talk about business planning and about income streams. I think one of the most important things when we're trying to put together any business really is to diversify our income streams. And one of the issues that we have in healthcare is that most of us are trained to have one income stream, which is direct service or direct care. And that works to a point, except the problem is that no matter how you make your money, whether it's through managed care or self-pay, after a while you can only raise your rate so high, or if you take managed care, they don't go up. But if you take self-pay, you can only raise your rate so high. So let's say the highest we could ever get anyone to pay, and I'm talking about maybe mental health at this point, because I know for physicians, the price points are different depending on the service you offer. But for mental health, probably the most you're ever really going to get anyone to pay per hour is going to be $200, and that's kind of on the high end. And some people in some metropolitan areas may pay more than that, but that's really rare. So you can only raise your rate so high, and then you really can only work so many hours. You can only see so many clients per week before you run out of hours and you just get exhausted and just don't take care of yourself anymore. And I do hear some providers talking about as their managed care income decreases, they keep taking on more and more clients, and I don't think that that's healthy, nor is it a really good business model, because you ceiling out. And this happened to me sort of by mistake. So when I started my practice, way back when, 6 or 7 years ago, I couldn't imagine having a full caseload. Like, I had no idea how I was going to go from having no clients in my private practice to 20, which is ultimately what I ended up with per week. 20 people per week, which is ultimately what I ended up with, I think, maybe within 12 to 15 months of starting my practice. And when I hit that point, I was seeing actually more like 22, 23, because I felt so bad that I couldn't bring in more people into the practice and help them. But I hit a ceiling. I said, wow, I can't fit any more people into this practice, because again, remember, a big part of my goal was being able to be home with my son, pretty regularly. So I can't fit any more people into this practice, and my rates are pretty much where they're going to be. I'm like, this is as much money as I'm going to make. And I didn't want to increase. I didn't want to add clinical hours. That's called that's called an hours for dollars model. So every hour you work, you get paid a certain amount, and that limits you into how much money you can make. So I had to figure out how to get beyond that and leverage my time so that I could make more money per hour and help more people per hour. So that's when we start talking about when people start talking about multiple income streams. I think sometimes as healthcare professionals, we think, oh, I need to offer different services. And while that's part of it, we actually need to really think about how to leverage our time and our skills so that we help more people in the same amount of time, and all those people are paying us something. So for instance, doing like a group program where you'd have 5 or 6 people, or 7 or 10 in a group, all paying you for an hour's worth of time, is a leveraged income model. But we also need to think about passive income streams, and passive income is when you don't have to physically be giving the service to get paid. So for instance, selling a book is a passive income stream because you write it once and you sell it again and again and again. So we have to really consider 3 kinds of income streams. One is direct service income, one is leveraged income, and the third is passive income. And so that's kind of what I ended up putting together into my practice, so that I had products that people could buy, which were the passive income. And then I had group type experiences, whether it was workshops or online coaching, where people could participate, many people working with me at once. And that's leveraged. And then I still had the face-to-face direct service income. So when you start thinking about a business plan, I want you to start thinking about your various income streams and how you're going to generate income that allows you to make more money than what the traditional hours for dollars models will let you achieve. It's really the only way to what Chris Brogan calls reach escape velocity, which is escape velocity is sort of getting beyond kind of the ceiling that you're going to hit. kind of getting out of the atmosphere, so to speak, and really growing a real thriving business that supports you and your family, probably in the way that you want it to. So that's really all I wanted to say about those income streams. It is kind of a lot to think about, and we'll cover that in great detail actually in my business planning program, because that's really the crux of what a thriving business is it has multiple ways to bring money in and support the business and support the person who is growing that. So this has been Dr. Susan Jaleo of the Biz Savvy Therapist.